Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics and geriatrics, in today's session we are going to discuss about 1 to 4 year mortality rate or the child death rate. What is the child death rate? Child death rate is the number of death of a children who are aged 1 to 4 years. And we are measuring per 1000 children in the same age group in that given year. You can see the formula here. The child death rate, 1 to 4 year mortality we are finding out. So the number of deaths of children aged 1 to 4 years in the year by mid-year population of children aged 1 to 4 years. Very important, you have to remember, in the denominator we have mid-year population of children of 1 to 4 years. Usually in all the topics, how did we study? We studied the neonatal mortality. For example, in the neonatal mortality, number of neonatal deaths, whatever the variable you want to find out, has to be in the numerator divided by total live birth. Right, in everywhere we saw the total live birth. Then if they asked perinatal mortality, we wrote number of the perinatal deaths which are occurring in a year by divided by total live birth. Or if they ask infant mortality, similarly for everything we wrote the total live birth. The only difference is that when they asked 1 to 4 year or the child death rate you have to write in the denominator the mid-year population. You have to consider the mid-year population of the children aged 1 to 4 years in that year. Okay. Then into 1000 multiplied by 1000. So this child death rate is the best indicator for the social situation in a country than the infant mortality rate. So we had studied, when we did the infant mortality, the previous video we studied that it is the second best indicator. Then which is the first best indicator for the social status of the community? It is the under 5 mortality rate, and also the social situation can also be better given by the 1 to 4 year mortality rate. Okay. Don't forget, if they ask the social status of the community, you have to consider that the child death rate is the best indicator. There are certain MCQs in this child death rate. We have the underlined part are the MCQs. We have that the child mortality rate or the child death rate does not suggest the under 5 year care of the community. Very important, the child death rate. Okay, don't forget the child death rate. It does not suggest the under 5 year care of the community. It only is an indicator of social situation. Also, it do not have the live birth as the denominator. Like we discussed, the denominator contains the mid-year population of that community in that particular year. Rather than the live birth, they have mid-year population. In the denominator, it does not have live birth, one MCQ, and the other MCQ which we found was it does not suggest the 5-year care. Okay, 5-year care of the community. Now, what is the cause of the death in the 1 to 4 year old babies? The most commonest cause in the developing countries are the diarrheal diseases and respiratory diseases. So we know that in the developing countries, the leading causes includes the diarrheal diseases, respiratory diseases. In addition to this, you can also write down the other causes like malnutrition or infectious diseases like measles, whooping cough, accidents, injuries. Whereas in the already developed countries, we know the most commonest cause is the accidents, followed by the congenital anomalies, influenza, pneumonia. All of these are found in developed countries. So guys, in the developing, most commonest, if they ask in the MCQ, the most commonest, you should mark diarrheal disease, respiratory disease. In developed countries, accidents. In your question, if they ask you a 3-mark question, a short question, what are the causes of the death of 1 to 4 year mortality rate or the child death rate, you can write down in addition to the diarrheal diseases, respiratory diseases, you can also add on the malnutrition, infectious diseases like measles, whooping cough, accidents in the developing countries. In the developed countries, in addition to accidents, we have congenital diseases, pneumonia, influenza, etc. Okay. Next, we have the child survival rate. So, there is child survival rate, or also known as child survival index. It is rate or it is index. The child survival rate or an index, it mainly includes the under 5 mortality rate. How do we calculate the child survival rate? 1000 minus the under 5 mortality rate by 10 divided by 10. Okay, don't forget the formula. The child survival index or rate is equal to 1000 minus under 5 mortality rate divided by 10. You can see the formula here. 1000 minus under 5 mortality rate by 10. In India, the child survival rate or child survival index is 96. Okay. So we know that in India, the child survival index is 96. Okay. So this was all about the 1 to 4 year mortality rate or the child death rate. Thank you.